So the main aim of Ayurveda is Swastasya Swasthya Rakshanam Adhurasya Pashamanam. Swastasya Swasthya Rakshanam. It doesn't deal with only treatment aspects in Ayurveda. The most important aim of Ayurveda is preventing the health of an individual. How to maintain health is a major task. See, we run an Ayurveda hospital and we have patients from different countries, and 90% of them are women. So we were thinking about what we can do to improve their health. So, and we have documented all the cases. And we found the reproductive health was the most important part which is at risk. And they end up with different diseases, as she mentioned, like arthritis, menopausal syndrome, hormonal imbalance, thyroid, diabetes, and you keep on naming the diseases. So the first step is understanding the principles in Ayurveda rather than just treating a disease and then treatment. It's not for this medicine, we give you not for a particular disease, we give you this medicine and you get healed. This is not the intention of this topic and this presentation. This is totally a different concept where we are going to introduce just the core principles of Ayurveda before understanding any disease regarding women. Is it clear? Are you interested to looking forward? Okay. I'm not going to tell you any medicines in Ayurveda which is going to heal you. So I'll just make the statement before we start the session. Okay, so don't expect medications as such as only treatment aspect, but we understand the principle. So you, wherever you live in the world, you can manage yourself and you can be healthy. Is it easy? And it is simple? No. Ayurveda is really simple. This is the first question my guru always says. Is it Ayurveda simple or easy? And the first step we say no. Definitely no. But he made a lot of efforts for us to understand really Ayurveda is practically easy to understand, and it is easy when you start implementing. Do you agree? Are you ready to implement something? So that is the most important concept, most important point that I want to share with you. Whatever we are going to speak, you can implement in your life. And that's not only medicines. And we are not going to speak about the medicine aspect. Is it clear? Okay. So there is a specialization in Ayurveda called as an individual topic called as Prasudi Tantra and Stri Roga. We have a separate, it's not a branch in Ayurveda, it's an, I can say, a speciality in Ayurveda which deals only about women's health, Prasudi Tantra. And Stri Rogam is the disease that is going to arise about of hormonal dysbalance, anything, and treatment. So treatment is not the basic concept in Ayurveda, is what we are going to understand in this session. Is it clear? It's not about the disease, it's not about the treatment, but understanding yourself. And each one is unique as per Ayurveda, and each body is different. So before we understand women's health, we first try to understand some simple concept about Ayurveda. Next one. What are the things you know about Ayurveda? Some principles behind Ayurveda? Have you heard anything about this before? So there is 5 elements, Tridoshas, Saptadhadus, Agni, Prakriti. At least 5 elements. How many of you know here? Definitely yes. So you are in fire 10, so you should know the 5 elements at least. Then Tridosha theory. The most important part is balance between the 5 elements, and the entire body is a composition of all these 5 elements. We call it as doshas. So when you understand the importance of doshas, the Panch Mahabhutas and the Agni, we understand Arogyam. Is the word Arogyam is comfortable for you? What is Arogyam? No. So Rogam is disease. Arogyam, without disease. So that is called as health in Ayurveda. So from now on, we'll speak about Arogyam. Is it fine? Yeah. So can you understand Arogyam now? Yeah. Yes. You are not tired? There is no sound? Yes. Yes. Not really. Okay. So the next slide. So when we speak about women's cells from the childhood till our the last date, we go through a cycle of changes. Nothing is stable in our body. It keeps on changing. So it's more important to understand our constitution first, to understand Tridosha, then to understand your disease. Does it make sense? Okay. So to understand yourself is to understand your constitution. How many of you know your constitution? Good. How do you understand that? Okay. Okay. See, this is the most deepest level of understanding in Ayurveda. We don't want to go into that level, but I'll give you a superficial understanding. It's nothing but a combination of 5 elements. Okay. So any dosha is a combination of 2 elements. For example, Agni, the fire and water makes the dosha Pitta. Okay. So we are in a which tent? Fire. So fire plus water makes Pitta. So air and space makes Vata. And earth and water makes Kapha. So that is a combination. So something mixed together to form a quality. This quality is what is Ayurveda, and that is the basic element which keeps on changing, and it is not stable. So this change is responsible for maintaining your health, and this change will lead to your disease. So there is a common cause. Like food is the common cause for a disease, and food is also acting as a medicine. Do you agree? Yeah. Lifestyle is a common cause for disease, and lifestyle is acting as a medicine as well. Do you agree? Yeah. So same in Ayurveda, the base is understanding of these 5 elements, which is nothing but a group of qualities. So group of qualities is undergoing a change, which will lead to some disease or something. So we will understand in a later aspect. Till now, is it clear? I will go into it. So we'll divide the woman's life into 3 main stages: childhood, middle age, and the old age. Can you give some qualities that you felt in your childhood? Do you remember? Cold all the time. Okay. Okay. Running nose. Okay. That's your childhood? No. Anyone? Energetic. Anything else you remember when you remember your baby photo? Smiling. Oh, great. Happiness. Then? Chubby. Okay. Anything else? Curiosity. Wow, great. Just remember your childhood memories. What do you get? Just think of when you're 5 years old, 2 years old. Okay. You're happy without reason, right? Do you agree that? Now can you imagine a day you're happy without any reason? For a moment at least? Not really. Okay. Anything else from your childhood? Pardon? Nature. See, playing. Okay. See, we are always try to know something. As she mentioned, curiosity. You're just happy without reason. It's universal. All the child is there. Because it's a group of quality that is common in all individuals throughout the world. Is it clear? So we understand. It's 90% of the kids are same. They can mingle with anyone, they can play, they can enjoy, they can be happy throughout without reason. That is the quality. So when we enter to the next stage of the life, especially the middle age, which starts after your teenage, but when there is a transmission from your childhood to middle age, there is a transmission period, right? We call it as a teenage. You could say we are not normal. Yeah. How many of you experienced that? Including. Yes. See, it's true, because body is undergoing a change. Do you agree that? So that's why teenage is considered to be the most vulnerable period, because your body is changing, your mind is changing, your hormones is changing. This 5 elements is undergoing a change, which is evident. Then we enter into the most beautiful part of our life, the middle age, where all the major crisis happens. Yes. You get married, you become a mother. So you can see it's like a volcano, or imagine the maximum crisis happens in your middle age. Yes. Again, it is a change. The quality changes, your body changes, you have started having wrinkles, your color changes. Okay. The last stage we enter is the old age, nothing but the most common name for everything is menopause. So whatever you name, you say it as menopause. Okay, but the transmission period from middle age to the menopause is again difficult. All women undergo a lot of changes, which is very critical to treat with medicine is the transmission period. Do you agree with that? So we can divide life into just three stages: childhood, middle age, and old age. Not nothing so much contribute in the kapha stage except for that cold and cough. So it's very easy because each child is universal. As per Ayurveda, we considered childhood is predominant of kapha dosha. What are the two elements in kapha? Do you remember? Yes, good. Water and earth. What are the qualities of water and earth? Heavy. Then? Is it boring? Little bit. Okay. But this is how we have to start, no other way. We are going into the most special topic. Unless we are familiar with these words, then only we can understand the remaining side. That's why. We'll go a little bit slower. Okay. The qualities of earth and water. Pardon? Okay. Flowing. Okay. Any other qualities? Pardon? Grounded. Solid, liquid, soft, hard. So it's a mixture of everything. The baby is crying, but it is happy. The baby is solid, it can understand, but it is innocent. So you can see the mixture of everything of these two elements in our childhood. Do you agree with this? Okay. So when one of the quality is more, when it is increasing, it turns into a symptom. Most of the babies love chocolate. Do you agree? Okay. That's 90%. But usually, child with Vada will never like chocolates. How many of you doesn't like chocolate in your childhoods? See? Yeah, including me. Okay, good. See, according to the constitution, it varies. This is what I want to explain to you. You understand? 90% of the babies predominantly will be in kapha dominant stage in their life. But some are Vada also, some are Pitta also. Okay. It's different. Each one is unique. So even the twins are different. So according to the dominance of your elements, the quality keeps changing. So childhood hence very comfortably with few things to manage. But this transmission from your childhood to middle age is most difficult. So this is where the puberty starts, the menarche starts. How many of you experienced a smooth transmission during a menarche? Very smooth. 1, 2, 3, 4. See, we can just count, just 5. How many of you have more difficulties when you started having your first menstrual cycle? See. So it means we never managed our childhood comfortably. Is it true? And we have gone through this, every one of us here have gone through this cycle. So, and we know it's not normal. Why it is not normal? Menarche and menstrual cycle is a normal one. Do you agree that? It's a natural one, true? When it is natural, why it is abnormal? Why it is creating a symptom? Any guess? Imbalance, very good. So the qualities are not in its normalcy. So this is like, there is a constitution, we have some qualities and some qualities are little bit above the normalcy. And some qualities are below the normalcy. So when this abnormality exists, our normal body will not be in its same position to do its normal function. This everyone knows. Is it clear? Okay. So we agree there is something abnormal. How to identify this abnormality? As a symptom. As you said, there is a pain. There is a running nose. There is an abdominal cramp. So every one of us is one or the other symptom which creates an abnormality in your cycles. Is it true? But we keep running with that. This time, next time, it's okay. We will have pain. It's normal. There will be abdominal care. We say it is normal. We will have back pain. Yes, it's normal. We started accepting that. Is it true? How many of us really find a solution to get out of it? Have we ever tried? Good. Only 2 in this crowd. 3, okay. 4. Only 4 of us. See, we started 5, okay. See, usually women always accepts everything. It's very easy, no? Whatever comes, okay, it's okay, we will manage. We keep moving, we push ourselves to the extent till like an elastic band, to the extent till it breaks. We keep on expecting and expanding our life. It's either with the symptoms or with the problems or with the miseries, we just keep moving. Is it true? Only few people take a different step, and we want to solve this problem. This entire presentation is about solving the problem, not with going with the same flow. Okay? Shall we move to a different step? Okay, we'll go to a different slide. So as we mentioned, we enter into the middle age, we have different issue. So we divide a presentation into 3 main topics. So today's topic is a journey and introduction to the preconceptional care. Have you heard of this word before? Yes. No. S is like this? No. It's not like this. So preconceptional care. See, Ayurveda has a unique way of presenting women's arogyam in our from childhood till the end, and each stage is considered to be so special, and there are a lot of rituals in our tradition to maintain this arogyam. Actually, we don't see it as a completeness in other places, but when you speak of Ayurveda, it's an holistic approach, deals with our daily routine, lifestyle, food, and everything together to maintain her health as the priority, so that our reproductive health is very good, and she is the only person responsible to create a new generation. Shall we enter the topic? I'm still introducing the topic to you. Okay. So next slide. So in today's world, the most why we choose this topic is that in this World Yoga Festival, 90% are women. Okay, do you agree? Okay, and every year we get cases with lot of infertility. 1 in 6 people have infertility throughout the world, and it's very important. It's not only just on the treatment basis, but to educate the women about the natural aspects of Ayurveda, where we can easily handle the situation. So how many of you have kids? Okay. Okay. So the next topic. What's it? So as we have discussed before, there is a change in the quality that leads to different diseases. So we have chosen infertility before we introducing the preconceptional care. Care is how we prepare the women for reproduction. So always there is a problem to start, like how we have a problem to start even the presentation. So we'll have a problem with us. We remove this solution and we make the reproductive cycle normal, and then we move forward. What is the first step in having a case of infertility is that they don't have a normal regular menstrual cycle. Is it true? Not in all cases actually, but the common symptom we all understand is that they could not conceive even after 1 year of repeated normal engaging in conception. But it is not possible due to different reasons. The main root cause is that, as we discussed before, it is the imbalance of the doshas. So we understand they could not conceive, but there is no solution. You go to your different places, you consult many people, and the answer is unexplained infertility. Have you heard of this word, unexplained? Like fever of unknown origin, infertility of unexplained. Everything is normal. You do all the tests, all the reports, everything is normal, but it is not happening naturally. So we understand that something is imbalanced in ourselves. Ayurveda has a wonderful solution for that. So we see and treat a patient as a whole. It's not only about a conception. It's about understanding as a person. So the first and foremost root cause for all disease in the world is ahara and vihara. Ahara is nothing but the food, and vihara is nothing but our lifestyle. Is it true? Is it true that food and lifestyle makes a change in all of us? And that will be the root cause for all the disease in the world. That's how Ayurveda sees. Wherever you are, whatever the problem is, these are the two major factors responsible for a disease as well as for a arogyam. So this is the first step in a consultation when we treat a women. So from here we take it forward to different step, understanding their body, understanding their constitution, then we understand the symptoms, then treatment follows. The second, so the first is the balance in doshas. Is it clear? So we'll go for the second point, is the weak digestive fire. How many of you experienced difficulties in digestion? What are the symptoms you have? See, you have the symptoms, right? You can say very comfortably. Bloating. Everyone has only bloating? Stuff. Okay. Constipation. Pardon? Fatigue. Headache. I think you have migraine. Not really. Anything else? Pardon? IBS. Okay. What do you feel when you have a weak digestion? Do you have appetite? No. Will you take food? Yes. Is it good? No. Then why we do that? Habit. Yes, that's the true. Say, and we do it regularly. Is it true? In 365 days, we know we are not hungry. We know we are not having a good appetite. We have a less digestive fire. But we are forced to take, it's breakfast time, it's lunch time, it's dinner time, something or the other. So we are loading our system more than it's needed. So it leads to a symptom like bloating, headache, constipation, IBS, whatever it is. But still we go on taking. If there is a capacity of a mixture is just 1 kg and you put 2 kg of food, how it grinds? Will it grind? Whether it is cooked or undercooked? Cooked. Completely or partially? Partially. That is how our system are. From this uncooked and partially cooked result of the food, we are going to develop our tissues. Then how our tissues will be? Is it complete in nature with full strength or it is depleted? Depleted. Then how we will produce a good offspring? Is it possible? Whether it will end up in infertility? Yes? No? So that's a root cause. Everything starts from the digestion aspect. What you consume is you. Do you agree with that? What you consume is you. That is your body, that is your mind, and that is your soul. So when your body, mind, or soul are different, we will have a symptom. And in infertility, that is the first step, is to correct your digestive fire. How many of you have good digestion today? Good digestive fire. Will you try to evolve why you don't have a digestive fire? You have. How many of you don't have? No. What's the problem? Pardon? Summertime. Okay. It's good. That's a different concept in Ayurveda. Do you have a good appetite in winter or summer? In winter. In summer, it's naturally less. Okay. So it's a good point. Thank you. So the next one is Dhadukshayam, which is nothing but the tissue depletion. We have understood from the weak digestive fire, which we will have the metabolism after the digestion of the food. The end product, we will not end up having 7 dhatus. Okay, so that is an impartial or formation of less quality of your tissues. So you the tissues are nothing but even your reproductive, the last part, the sperm and the ovum also comes under your sapta dhatus. Even there is a, it's not working. I'll call her. She's here. Okay.
I'll be back.
Sorry. So we are in the root causes of infertility. The first step is the imbalance of the doshas, then in the Agni, then with the Dhatu level. So the next step is understanding a symptom. So there is no production of a good fetus. So what is the principle is in Ayurveda, the treatment starts with eliminating the root cause. What is the root cause? Correcting our ahara and vihara. What is ahara? Food. So we have to understand ahara again from the basis of 5 elements, which is nothing but the combination of 6 rasas. Can you explain what is 6 taste? 6 sweet, salt, sour, bitter, pungent. Do you take all 6 tastes in your food? No, not really. How many tastes do you have? 1, 2. Okay. No stringent. See, today everyone takes vitamins, tablets, minerals, calciums, everything as a supplement but not as a food. So it's going as a medicine but not consumed as a food, entering your metabolism and creating a new tissues. So there is always a depletion and we are on supplements. To understand this, we should start consuming food which is having a 6 taste. Is it clear? Okay. So Shadrasa Ahara. So 6 taste food is very important to maintain your Agni. Once your Agni is maintained, you will have a common regular cycle. As we have discussed, there is an imbalance in your menstrual cycle. Okay. So the first step is that you don't have a regularity, that you don't have a 28 days cycle. Each month it is different. Sometimes you don't have it for 2 to 3 months. Sometimes you have it very early within 2 weeks. How many of you have menstrual disorders? Irregular cycles, abdominal pain during menstruation, headache, nausea, back pain. Is it normal to have any symptoms during menstruation? Not really. See that the true menstrual cycle doesn't have any symptom. It has a very fresh blood which resembles like a cut wound. It should be very bright in color. It should never be dark red or brown in color. That's the first sign. The second symptom is that it should not have any associated symptoms like back pain, vomiting, headache, nausea, nothing else. So that you don't feel that you have a cycles anymore. But 99% of the women experience abnormality or one or the other symptoms during your menstruation. Is it true? It means it's not normal. So what are the steps we have to take to change this cycle? Have you tried anything else to change your menstrual cycles? Pardon? Okay. Okay. Good. Anything else? We just accepted it. Okay. Yoga. Very good. We are in a World Yoga Festival. Yes, we have to. Then? Okay. How do you feel on your first day of your cycles? Do you have your normal energy? No. How is your appetite on your first day? Do you have your normal appetite? Have you experienced it? No. So when there is no energy, when there is no appetite, how should you consume your food on your cycles? According to your Agni. It's not the quantity alone to be less. You should take food which is very easy and light to digest. Do you agree that? Can we try this from your next cycles? The first step. I'm not giving you complicated solutions to take a lot of herbal decoctions. Just to take a light and easy digestible food on your first day. And how many of you rest during your cycles? A big no. Is it possible to do physical activities during your cycles? Yes? No? See, you said you don't have an energy like normal energy, right? and you have a weak digestion. Is it possible to do a physical activity? Is it normal to do? Oh, we should not, right? See, like how in summer our energies are different. In winter, the energy is more. You can do all your physical exercise more in winter, but not in summer. Same when we have a menstrual cycle, the body is different in its energy and in Agni level. So we should rest on the first day at least to maintain this change. Do you agree with this? Yes. See, today's world we have lot of PCOD, polycystic ovarian syndrome. Even starting from the 12-year-old kid till 40, for late 40s, we have a number of patients complaining of PCOD, increasing in number, and there is a possibility to develop into a ovarian cancer or cervical cancer, and we get lot of patients because it is not managed at the proper time. If we could have a regimen of your menstrual cycle, we can definitely prevent lot of diseases. This is the first step in Ayurveda that we understand ourselves. Just to accept, it's not accepting, it's just observing. Can we observe ourselves at least from today? Yes. Okay. At least you can go for a job. It's not riding your cycle, you're jumping and doing a gym activity. At least you can stop that. Okay, it's not you're lying down 24/7. Something has to change from our side. You are not excessively straining yourself. Is it clear? So in olden days, that's a restriction, in especially in India. I don't know about other countries. We are not even allowed to move out of the room. You are served. Even the food comes to you. Yeah, we think it as superstitious belief that this, and we have removed this. Actually, that is not so. You are given physical rest at least for 3 days. And they will serve you very light, warm food. So your Agni is maintained, the body is regained, and when you come out of the cycle, again there is a physiological change, so that the body is easy to come back to the routine in a very comfortable age, and they have all, and I never heard of infertility in my grandma period, where they deliver 10 babies at home, and the infertility rate is really less. In last 50 years, it has scaled to such a height, even it's going to increase in nowadays. That's why we are going to choose this topic. To begin this, the first change we are agreeing to do is to rest on the first day of your cycle as much as you can, and to take a light food. Is it possible? How many of you are going to follow this? It's not to rest as like, don't do any physical exercise. You can change your holidays or off days on that day. So you can minimize at least to 50% of your work you do. Can you postpone something? So at least here you can think of that. See, nothing is impossible, but we have an alternative to do that. Okay, we can try.
I think what she's telling is also that the approach, like in you may be yoga teacher, you may be doing the class, but the intention is the energy what you're taking into the class. In menstrual cycle that day, you have to work, but that's my point.
What's the slide number?
That go gentle with yourself rather
No,
than
no, no.
doing your full headstand or anything intense. Softer approach will be a much better way of looking into it.
Thank you. Do you see this is a cause which is going to create a disease in our system? Can you see the link? Looks so simple, looks so small. But see, the menstrual cycle is for 20 to 30 years minimum. Okay. If you are not able to think and maintain this reproductive life, we cannot prevent so many things later stages. So it starts here in the beginning. So you can tell your child, your relatives, your kids known, everyone to have a wonderful menstrual cycle without any abnormalities. This is the first step. Then when they have a transmission, when they enter into their reproductive life, when they are planning for conception, everything falls very easily. And we can prevent infertility to a greater extent, without medication, without treatments. Does it make sense? Okay. Next slide. See, when we speak about irregular cycles, the first thing is that we have said about delayed cycles. So many patients, they don't have cycles for 3 months, 8 months, 6 months. Have you experienced that? Yes. We have heard of it. Everything have heard of it. Here, the imbalance is that the kapha dosha, the earth and the jala elements have changed in qualities. They have increased to the extent that they don't have the normalcy, normal functioning have changed. So like people travel to different places, when they go from school to colleges, they stay in a different place. When they come back to their home, they have regular menstruation. But when they are staying there for 8 months, they don't have. So there is a link between our mind and body. It's not only your body. So there is a link between your body and mind that creates a change. So to understand what is the cause for your change in your cycles, then you try to make a balance in your daily routine. That is the first step in Ayurveda to start treating your problems. You should understand what is the cause. And removing the root cause is the treatment principle. Is Ayurveda simple? Still no. Okay. Ayurveda is simple. No. The second one is we have painful menstruation. I think that's the most common among all of the menstruation. The pain keeps increasing. It's because of the one important quality, the dryness in the body keeps increasing. We work late nights. Keeping awakening at night is one of the main factor that leads to painful menstruation. Every one of us does this. The last 365 days we do this. Is it true? We keep awake at night. We work late night. We don't sleep in the proper time. This is a daily routine. I'm just speaking about your daily routines. Nothing special, nothing out of the box. This is adding to the point to have your painful menstruation. And the most important all women does is suppression of your natural urges. We cannot urinate when you feel like. We cannot go. It's there, working, we are driving. We give lot of excuses so that we do it every single day and we develop pain, we understand, and we start having a pill which further increases dryness in the body. So the first step is understanding your problem and what is the root cause of the problem, and eliminating the root cause is the simplest solution Ayurveda tells to all diseases in the early stage. Just by removing the root cause, we can manage into a better shape. Is it true? Is it possible? If you are in the first step, right, we can easily do that. If you are in an early stage. When the disease becomes chronic, when you have a regular menstrual cycle for 3 years, 5 years, definitely it is not possible because you need the help of a medicine and accelerating factor to come back to your normalcy. Most of us we are in this middle period because you need something else to accelerate your normalcy because the system cannot do its normal work. So this is the main factor in PCOD. This is the main factor in infertility cases. So we have to understand the causative factor before we treat a problem. It's not treatment, it's just going to your doctor and getting a pill, you get cured. Definitely no. It is not possible in Ayurveda. It is only about you. You have to change yourself before you are planning to change your disease. When you understand this concept, any disease can be cured and any disease can be managed. Whether it is your diabetes, infertility, or whatever you name, the treatment plan becomes more simple. We have many patients coming to our clinic. Nikki is here. She is here. They are learning Ayurveda with us for so many years. Anita is here. They all know this principle is more important than what the treatment itself is. Do you agree with this? Okay. Next. So what is the treatment principle? As we have discussed now, there is a cause. So removing the cause is the treatment principle. So whatever symptom you get in your life, it's whether cold, cough, painful menstruation, headache, there is a cause. Is it so? So there is a cause and an effect. You have a cause, you get a symptom. You have a cause, you get a problem. So can you identify a cause that is creating a problem in you? Is it possible for you to identify the cause? Is it a difficult task? No. And every one of us are fair enough to identify a cause very simply. Can we work on that to make a change? Shall we start? No. No way. Now, first we understand ourselves. As you know, you all know your cause. So, write down your cause. You know whatever you have, whatever the symptom you have an idea of your clue. For example, you have a migraine, you know, sound increases my headache. Constipation increases my headache. Blood pressure increases my backache. Each one knows the cause. Can we work out on that? You just write it down. List down your symptoms. Just list down what all you have and think what are the causes that can make a change in you. Is it simple? No medicines. Okay. This is the first step in Ayurveda, finding out the root cause of your problem. Once you identify the cause, 75% of the treatment is done. You no need to treat because you know what is creating a problem. So we can work on that and you can manage by yourself. You no need a doctor. But when you don't know your cause, definitely you need a help. So then you have to consult a lot of physicians to identify the cause and to give a medicine to treat the cause. Okay. So that is why in PCOD even we don't identify a cause. It's an unknown origin. Infertility of unknown origin. So try to identify the cause, then we will move forward. Okay. Next slide. We have discussed everything. Next. So the next step is, as I said, the first step is treating the cause. The second step is the influence of a doctor. You go to your physician and he gives some medication to accelerate your problems, which is nothing but the herbs or decoctions, whatever it is, to improve your Agni, to improve your digestion. Even the medicine should undergo a digestion, only then it will produce an action in your system. Do you agree with that? Your body doesn't know it's a herbal decoction, coffee, tea, whatever it is. It also should undergo a digestion to produce an action. So when your Agni is less, the medicines will not undergo digestion. So it's not all the time you keep on putting a pill and expecting a change. It will never work until your Agni is clear. So improving your Agni, then treating with the medicines, that is the role of a physician, then the treatment is more successful in Ayurveda. Okay, so don't load too much, just understand your appetite first. This is the first question you should ask to yourself every day when you wake up. Do you have appetite? Am I hungry? If your answer is yes, then take food. If it is no, please wait till the next meal. When you are having a good appetite, then you consume meal. So the cycle becomes more easy and it can prevent n number of diseases. It looks so simple, but it is the first step in every problem we come across in our clinics, and this can correct 70% of the diseases without medicine. Okay. So the next step, if people doesn't follow any of this, I don't want to identify the cause, I don't want to do this. So we have the next step, we should do some purification treatment. We have to get them admitted in our hospital. We should start them, have consultations, start with the medicines, and we have to do eliminating the doshas. It has gone to a state level which cannot be suppressed anymore, which has to come out of your system. So we do different types of treatment, internal and external. So to bringing the doshas to your abdominal organs, and from there it is eliminated to different ways. So these are the 5 purificative treatments that we do to eliminate the toxins from your body, which is called as Pancha Karma. Pancha means 5 and Karma means therapeutic procedure. So there are 5 procedures through which the toxins are getting eliminated from your body. I think few of you know about this. Pancha Karma. Have you heard this before? Yeah. So at last, so we do some treatments to make sure it is getting eliminated. So it has gone to a stage, it has become so chronic, and to that stage we have to do this and we get beautiful results also. Yes. Is it clear till now? Have you understood few core principles of Ayurveda before entering to the main topic? I have not even touched the topic. Is it clear? Are you feeling sleepy? I don't hear any sounds. Are you feeling sleepy? No. Shall we go into the topic? Yes. I'm actually starting the topic now. Okay. Do you agree with this sentence? Fertility mirrors your overall health and well-being. It's more important to understand our daily routine. Is it important? How many of you have a systematic daily routine in your life? Can anyone share your experience of your systematic daily routine with us? Yeah.
Well, I try and get up relatively early
Okay.
and drink hot water when I first wake up.
Okay.
Warm water, not like boiling.
Okay.
And then I do my yoga practice.
Okay.
And sometimes that's 1 hour, sometimes that's 30 minutes, depending on what meetings I have in the day.
Okay.
I am self-employed, so it's easier for me than some people, I guess.
Okay.
Then I begin my work.
Okay.
I'll just drink some tea, then I'll go and have my lunch, take an hour break, go for a walk after lunch, come back, do more work, then have dinner, kind of around, I think I should probably be having it earlier, but I have it around 7:30. After that, tend to talk to my partner, maybe watch a movie, relax, unwind, have tea, bed. I mean, there is more to it than that, but I pour the wealth of my day.
Okay. You have tea and end your day. Okay. Do you take food 3 times according to your appetite?
Yeah, I do take food 3 times, but when you were saying you should only eat when you're hungry, I am like always hungry.
Always hungry. That's also a problem, right?
So that is a problem.
Yeah. It's mean your Agni is too much. It's overcooked. When you put 2 kgs and the Agni is too much, it cooks in few minutes. Okay. When you have less Agni and you put 2 kgs, it is undercooked. So according to the intensity, we should keep adding the fuel. Okay. So daily routine is important, right? Systematic daily routine. So when the health is normal, so we come upon 3 important pillars of life. Can you guess what are the 3 important pillars in life? Sleep. Good. How many of you have a good sleep? 365 days I sleep well. 365 days I sleep well. Very happy to see you. And a very big congrats from our side. So that is the major disease today. We deal with a lot of patients. They have a lot of sleep disturbances. Okay, that's a pillar of life. We call it as pillar of life. So you can understand the importance of it. And many women suffer from sleeping disorders. Do you agree? Okay. Can you understand why? Can you give some causes for that? Pardon? Okay. Multitasked. Okay. Lack of routine. Okay. Stress. Okay. Okay. See, like we know it's a pillar of life and it is common for, and it is universal. Everyone sleeps all over the world. Yes? Can we make a routine to have a sleeping habit every day? How many of you have early dinner? Good, most of them. Very nice to know that. So you are away from many diseases. 2 hours before your sleep. But the sleep should be the first part of the night, which is before 10. How many of you sleep before 10 o'clock? Very nice to know. Okay. So you are 90% above the world's population so that you don't have much diseases. The people who sleep late in the night are more prone for a lot of issues. Okay. Today's our main topic is about fertility. pre-conceptional care is very important, and it starts with understanding your system first, where Ahara Vihara is the main role, and we enter into the topic now. Before slide, please. No, before the one before. The one before. Yeah. So healing infertility to Garbhadana Samskara. Garbhadana Samskara is the main topic. It is an individual word in Ayurveda where we prepare a conscious conception, which is the journey of conception. That's the topic today. We are just opening. There is a word called as Garbhadana Samskara. Samskara means it's a ritual. In Indian tradition, we have 16 samskaras to go through in our life, which starts even before conception, and it ends with the last ritual when the person is dead. So we go to different life stages where each life cycle is appreciated with a milestone, and we have some rituals and ceremonies with the family and the friends so that the child is growing in a better stage in their life. This is the first samskara among the 16 which is done after marriage. Okay. So conscious conception is very important in today's world to have a wonderful generation. Do you agree with this? How many of you had conscious conception? Very good. Happy to know. How many kids you have? 2. Great. Anyone else? Good. 2 kids. Yeah. Yourself? 2. Very nice. 1. Twins. Great. 3. Great. See, to take a cloth, to select an outfit, we go to multiple stores. We want a particular pattern, color. We spend a lot of time in searching. But to have a journey throughout our life, we don't plan for our own kids. We don't spend much to know about them. So in Ayurveda especially, there is a particular way understanding the ritual behind conception. It's considered to be a ritual. It's not just coming and having a baby. There are a lot of procedures to be followed by the parents, both male and female, to understand life before they starting their journey towards conception. This is most essential in today's world to prevent infertility and to have a wonderful generation with the kids are normal, energetic, intelligent, and they are totally different, and they can create a wonderful generation for the world also. It's most important as we believe. Yes. So have you heard the word Garbha? Garbha is nothing but the fetus itself. It's an embryo. Adhana is nothing but placing or implanting the fetus. And samskara is nothing but the ritual by which the conception happens. So Garbha, Dhana, Samskara is the pre-conceptional care that has been explained in Ayurveda. Is the word clear? Can you repeat? Samskara. Samskara is something, it's a process by which something becomes pure. Any procedures that we done to make it pure is called as samskara. It's a purification process. So we churn, we melt the butter, it becomes pure, we get the ghee. So it is a process of converting something, so we get a pure quality out of it. Similarly, we also undergo different changes. We follow certain rituals to have a better outcome out of it. So Garbha, Dana, Samskara is nothing but the pre-conceptional care in Ayurveda. Is it clear? Is the topic clear? Yes. As we discussed, Samskara is nothing but it's going to remove the unwanted qualities within us. So like a stone, like a person who make the sculptures out of it, he keeps on beating the stone. So from the stone you get different statues out of it by removing the unwanted things. Same that happens with our body, mind and soul. So we should know some process that connecting mind, body and soul. So to have a pure sattvic person out of it. When we are in that state and you plan for your conception, you can imagine the beautiful soul that is going to enter into your family. Do you imagine the child that is born after a proper planning, after doing a lot of rituals? Do you think of your childhood? Being so healthy, being so energetic, so lovely, not crying, able to understand everything, matured enough, without any disease. The entire generation, if it is so, this you can imagine 100 kids of the same place. We will not have any patients anymore in any clinic. Is it true? So it's more important in Ayurveda to start this from nowadays, expanding this concept to different people so that we have a wonderful generation. Okay, for today we will stop here. Tomorrow we will continue this topic. The third day we will talk about the pregnancy care and the postpartum care. So, and we'll end with menopause and its importance in Ayurveda. Okay, thank you. Do you have any questions? Any doubts? No questions? Sure. Can you little bit louder? So, when you travel, your Agni changes. That was the question. Definitely yes. Yeah. So again you understand you're traveling for 16 hours, 18 hours and you land in a different place. The body needs time to get adjusted to that environment. So it depends upon the place where we live. It's not all have the same Agni at the same time. Each one is different. So when you travel and you land, just understand if you're not hungry, wait for the time. Just have some warm water to kindle your Agni, rest yourself, and only when you feel that, start. Otherwise, don't give a start. So you can easily come out of the jet lag very comfortably when you understand yourself. Okay. Any more questions? You want to know some food that you want to consume to. Like we can have khichadis. Okay, most easy. You have rice or dal, some vegetables, soups, whatever you like. You don't have a junk, processed, heavy food to digest. It should never be a fermented food. Yeah. It's more easy, no? You just take. Even when you have a fever, what we do is we take very simple food so you don't keep giving a system a load to get digested. Same that happens when the Agni is not balanced, body is undergoing a physiological change. You have to support the system. When you give a heavy food, body cannot change. The change that is happening internally as an impact, so it stops working normally. We end up having a different symptom. That's why in the next cycle, you can see the change. You have different symptom in the next cycle. The cycle never be normal without any associated symptom. It should be very normal, without any pain, without any nausea. So when you consume regular food, the cycle becomes normal. You don't have irregular cycles and no other associated symptoms. Okay. Anything else? Sure. Okay. Yes. Mm. Okay. Physiological. See, it is not a pathology, it is not a disease actually. Menstrual cycle is a physiological, same pregnancy is a physiological one, it's not a pathology. So when the body changes, you will have different craving and you can work on that. So you should have a strong mental preparation to work on that, right? That's why we have lot of rituals in a month, Ekadashi, this and that, to prevent and to enroll that habit into your system. Definitely yes. Definitely yes. Each body is different. Each one has different. It's not craving for all the women. Same. It's not the craving for even for the next cycle. It may change. Yeah. Anything else? Can you little bit louder? Yeah. Sure. Yeah. So the normal menstrual blood should be fresh, bright red in color. When you have a cut wound, fresh wound, the color of the blood is very bright. It should be like that. That is normal. But mostly it is dark brown or dark red in color, which indicates there is a dryness more in the body, which is equivalent to a particular dosha in the system. Okay, and depending upon the flow, for example, some people doesn't have a flow on the first day, second day the flow is more, third day the more is more. It is again contributing to a change in a particular dosha. And some people have heavy clots. Instead of flowing, they have a solid like a clot that is coming out. It indicates the imbalance in a kapha dosha. So we have to find about the flow, the color, the clots to understand which dosha has undergone an imbalance, and we treat accordingly. Is it clear? Yeah. Anything else? Yeah, sure.
You mentioned earlier about polycystic ovaries,
Mm.
that they're becoming more common.
Yeah.
I have two nieces who are in their very early 20s, and
Okay.
they've both recently been diagnosed with it. And one of them hasn't had a cycle for 7 months since she started her job. Now, you talked about taking away the cause, but she can't stop work. What would you suggest? Is it a change in diet? Are there other habits?
No, she will not have cycles for 7 months. She have only cycles once in 7 months.
Yes, she hasn't
Okay.
had one since December,
Okay.
when she started her job.
The first step is again starting with your ahara and vihara. The diet and lifestyle has to be changed. Unless we change in our daily routine, we cannot really make a change in anything else. This is what Ayurveda emphasis on every one of us. You have to make sure you change your daily routine so that you prevent a disease.
Do you think that psychological stress there's this big psychological element?
Definitely, yes. That's been mentioned as one of the causes in the previous slide. See, we take everything too much into our system. We accept in a different form. Some people accept it with grace. Some people, it's very difficult to accept something. So when it is loading you, it causes a lot of issues. That starts with sleep disturbances, it ends up with hormonal change, creating PCODs. So the cause is all included. It goes with cycle.
For 20, my niece, for 20-year-old, it's very difficult to, who's just starting off in life,
See, it's the most important part.
psychological issues, the diet issues, all those issues are very difficult to address when you're 20,
Yes.
19.
So that's why we said we are just in the transmission period from your childhood, you are entering into your middle age. So definitely this transmission is tough because your body is not even normal. Your hormones undergoing stage, and this change, this transmission to maintain, that's where yoga, meditations, sadvrata, all the natural elements helps you to follow. So that's why we start before menarche. We are speaking from there so that they have their regular habits set in our life. So that will make this change very comfortable. See, I don't remember our olden 50 years back, 60 years back, some people are complaining about of menstrual cycle because they have a perfect lifestyle according to the season where they live. So this transmission was very easy. But today there is no pattern, there is no cycle at all, there is no routine. We go with the flow and it flows like different ways. We end up in different issues and we could not find a solution because we take it too seriously or we take it too light. The most important, we don't prioritize. All are working towards your, as you said, with your job thing. The most priority in our life is arogya. And everything is following this, and this is the base. When you have your foundation set, everything will fall in order. We can see people at the age of 90, 94 in our clinic without any complaints because they have one thing in common. They have their daily routine set in. At the age of 94, no BP, no diabetes, no issues at all. And they're still walking, they can hear, they can read, they even know to use all the applications, including WhatsApp, audios, not. Everything perfect. And they can use any device because they know the reality of life, accepting life, taking it so easily, understanding their ahara and vihara and managing them.
And adjusting their routine
Yeah.
according to changes in their life.
Yes.
And this is what my niece is having problems. She would go to the gym, do this, do that.
See, it is like an obsession. See, we want to do everything, which is not possible. No? Every woman are multitasked already. And we want to do everything that is happening around us, which is not possible at all. We have to understand we cannot do something, we can do something. And we have, for example, 10 lists to do in a day. And we could finish only 5. And we are guilty for the 5 we couldn't complete. And tomorrow it is 10 plus 5, so it is 15. All the more you are stressed. I couldn't do this, I couldn't do that. See, it's 15 plus 5 for the next day. And it is a long journey. We always have a pending list. See, first thing is accepting life as it is. It doesn't work, it doesn't work. What is the next option? We have to start thinking. Otherwise, throughout our life, we have problem. And we always expect to have unexpected things happening. Whether it is your job, whether it's a relationship, whether it's anything, always unexpected is expected. And when you prepare yourself, this is where Ayurveda, this is where the rituals, this is where the culture helps us to move forward. That's why prayers makes everything different, to look different. It's the same problem, it's everything is the same. But the way we address the problem change so that we are moving towards a solution to the problem, not we get stuck with the problem. All patients come with different issues, they get stuck. Infertility, that's it. Menopause, I'm done. No, it's not so. Before 50 years, nobody knows what is menopause. But today, at the age of 30, we are speaking about pre-menopause. I have this, it's equal to menopause. This is equal to that. We really want to name with a disease. We think it is a prestigious issue to say, I am diabetic, I am hypertensive, I am... It's not so. Nobody is ready to say, I am completely good without anything. Not even a single one of us. We are not able to understand this balance and to see everything from a different perspective. Definitely life has everything to follow, but it is not stress. It's a way of life. That is why it's Ayurveda. Understanding the life as it is. Am I clear? Sure. Okay. So tomorrow will be the main topic, so we'll be taking you to the role of conception. The concept, the idea of this seminar is not to just to give some symptom, some treatment, some name of the medicine, which we really don't want to do. Just the concept. So you can go and think about yourself and you can manage whatever you have without the aid of a physician was the first step. Then you have something, you can come to us. Okay. Sure. Okay. Yeah. Yes. You're most welcome. Thank you so much. Back. Oh.